I'm going to be your student nurse today. I would perform hand hygiene. I would make sure that there is privacy. I would make sure that the patient is comfortable. So can you please state your name and date of birth?
Morgan Brandner, 9/22/97.
All right, so that checks out. So first, what we're going to be doing is I'm going to be doing a head-to-toe assessment on you. Just let me know if at any time you want me to stop. Okay, so first I'm going to inspect the head. I'm going to inspect for lesions, masses. The skin, the scalp is dry, intact. There are no inhabitants. The hair distribution is normal, and his head is normal celiphac. So I would look, you can just look straight at me. I would look at the face, so the face is symmetrical. There seems to be no drooping. Can you puff out your cheeks for me? Can you smile? Can you frown? All right, so facial nerve is intact. And then can I see the eyelash and eyebrow hair distribution is normal. There is no drainage from the eyes. It doesn't seem to be irritated. The sclera is white. Can you pull down your eyelid for me, both of them? So the conjunctiva is moist and pink. The corneal light reflex is equal bilaterally, and the pupils are equal and round. I need a flashlight. All right, so I'm just gonna have you look right at me. So then I'm just gonna have you look right at me again, and then watch this pen. So Perla, and then watch this pen, follow it, don't move your head. So EOM is intact, there is no nystagmus, and then can I have you read my name tag?
Yep. Westminster College School of Nursing and Health Sciences, Nowhere student nurse.
Okay. So vision is intact, and can I actually just have you turn your head? So the ears seem intact. There seems to be no skin breakdown, no lesions, no masses. So there is no drainage. There is a moderate amount of cerebrum, and there seems to be no irritants within the ear. I'm going to have you close your eyes and tell me where you hear my fingers rubbing.
Both. Left. Right.
All right, so hearing is intact via finger rubbing test and via conversation. And then can I have you look straight at me? Can you plug one in your nose and sniff and do it to the other one? So right and left nasals are slightly occluded, and then can you face towards me? The mouth is moist, pink. There's no lesions around the mouth. The skin is intact. Can you open for me? So buccal mucosa, tongue, gums are all pink, moist, with no lesions. The teeth are intact. There's no chipping or decay. Can I have you open and say ah? All right, so uvula rises midline, and there seems to be no irritation in the throat or the tonsils. So then what I'm going to have you do is I'm going to assess your neck now. Can you swallow for me? Is there any difficulty or pain with swallowing? All right, so trachea was midline. I'm going to palpate your lymph nodes. Any pain? All right, so no enlargement of the lymph nodes. Can you put your neck to the side, other side, back, and then forward? Patient has full active range of motion of the neck. And then what I'm going to do is I'm going to auscultate your carotids. right, so I auscultated the carotids. There are no bruits heard, and then I'm going to palpate. So carotids were 3+ out of 4 equal bilaterally. And then I'm going to actually have you take your shirt off.
I'm gonna stay sitting.
Yeah. All right, so I'm going to assess your arms now. So the skin is dry and intact. There are no lesions, no masses. There is equal hair distribution on the lower arms. I'm going to palpate your joints. Let me know if there's any pain or tenderness. Any pain, any tenderness? All right, so no pain or tenderness. When palpating, there's no edema in the arms. And then I'm going to look at his hands. His nails are smooth, they're not cracked. And there seems to be no clubbing or hypoxia. And then the cap refill time is less than 3 seconds. There is a scar on his left medial wrist, but everything else looks fine. Can I have you put your arms out for me? Up and then across. All right, so active range of motion, you can put those down. And then can I have you push on my hands? And then pull up on my hands. All right, so patient strength is 5 out of 5. And he has active range of motion. And then can I have you squeeze my fingers? So patient has finger strength 5 out of 5, and then you can feel me doing all of this. Yeah. So patient has full sensation in fingers, and then I'm going to just assess your radial pulses. So radial pulses were 3+ out of 4, equal bilaterally, and they were strong. So I'm going to actually have you face that way so I can inspect your back. So just turn slightly that way. Okay, so the patient's back is dry, the skin is intact, there are no lesions or masses. You can sit up straight if you want, there you go. And then I'm going to palpate the spine for any deformities. So no deformities. All right. And there are no lesions or masses, no pain or tenderness. And then I'm going to percuss. Tell me if you have any pain. No pain, no tenderness. So no pain or tenderness at the CBA. Can I have you take a deep breath in for me? So chest expansion was equal. There was no, all right, so I'm gonna auscultate your lungs now, so you can just take deep breaths for me every single time I move my stethoscope. All right, so lung sounds were clear throughout all of the lobes. You can sit back now. All right, so now I'm going to inspect your chest. So I'm gonna inspect the chest. The hair distribution on the chest is normal. The skin is dry and intact. The temperature is warm on all extremities, even the arms. And there seems to be no lesions or masses, so I'm gonna palpate the chest. Tell me if you have any pain or tenderness. Any pain, any tenderness? All right, so now I'm going to auscultate your lungs on this side, so just take a deep breath every single time. So lung sounds were clear throughout. There was no signs of crepitus or crackles. I'm now going to listen to your heart sounds, so you can just stay right there. Alright, so S1 and S2 were heard. I did not hear any abnormal heart sounds. And then I'm going to go back up with the bell and then listen at the mitral for 60 seconds. Alright, so with the bell, S1 and S2 were heard, no abnormal heart sounds. When I listened to the mitral valve, I counted 32 beats per minute. Alright, so what I'm going to do now is I'm going to have you lay flat this way. No, head that way. Alright, so I'm going to inspect your abdomen. So the abdomen, the skin is dry and intact, there's no lesions. The abdomen contour is flat, the musculature is well defined, the hair distribution is normal around the navel. So I'm going to auscultate your bowel sounds. So bowel sounds were normal, and I was able to hear gurgles. So 5 gurgles in every quadrant. So when assessing abdominal aorta, I heard no bruits, and everything sounded normal. So what I'm going to do now is I'm going to palpate your abdomen. Tell me if there's any pain or tenderness. I'm going to do it lightly first. deep. So any pain or tenderness with that. No organ enlargement, no distension, and I could palpate without any pain or tenderness. So you can sit up for me, just that way, and inspect your lower extremities. So the legs, the hair distribution is normal. They seem symmetrical. There seems to be no deformity, injury, or arthritis. The skin is dry and intact. There seems to be 3 scars on the left knee cap and then 3 scars on the right kneecap. And then I'm going to actually have you put your knee to your butt for both legs. You don't have to try, it's just active, and then push out, and then do it for the other one, push out, and then put your leg to the side, and then over towards me, and do that for the other leg, and then back. All right, so then can you push up on me, both legs, and then push down? I know that's hard, but, and then I'm going to have you push up against me with your foot, push up against me with your foot, push down, and then push down. All right, so patient had active full range of motion with his lower extremities, and the strength was 5 out of 5 on both legs, and also on the dorsal and plantar flexion. The cap refill of his nails on his toes are 3 seconds. There seems to be, the nails are smooth, there's no cracking. You can feel me touching your toes. All right, so patient has full sensation in his toes. And then can I have you sit up and put your legs on the side? I'm just gonna test your plantar. Can you sit back as far so then your feet are just laying? Because I'm gonna test your patellar reflex. Alright, so patellar reflex was 2+ out of 4, and everything was normal with that. And then what I'm going to have you do is I'm going to have you stand up with me. I'm going to have you bend over. So no spinal deformities, no scoliosis. I don't see any deviation of the spine. Alright, I'm going to have you stand up. And then what can you just sit there for a few minutes with your eyes closed, feet together. All right, you can open your eyes. Rombard test was negative, and then can you walk in a straight line for me? That way. And then walk back on your toes. All right, so patient's gait was smooth and stable, and he was able to perform one specialty.